Hi guys, in this video I want to talk to you and give you a little bit better understanding about scoliosis and about some of the things that we can do to actually help improve lateral curvature of the spine. So before I do that, let me actually kind of give you an understanding of what is ideal, what's optimal to see, and then give you an understanding of what scoliosis is. And then also there's several different causes of scoliosis. Some people are born with it, some people develop it, some people it's because of degeneration, some people it's neurological. So there's several causes. It could be several causes, and really, truthfully, it's not completely understood and completely known why some people have it and some people don't. So let me tell you what is optimal to see, what's ideal to see. So on this little picture here, there's just two little drawings here. I know I'm an amazing artist, and that's what you're thinking. But when you look at this is looking at someone, they're facing us. So we're looking front to back of them. Ideally, when you look at someone, the spine should be straight up and down. That's the most stable position. Oftentimes you can see that in people's posture. When you look at someone's posture and they're staying straight up and down, you'll see that their shoulders are level, their head's straight up and down, their hips are level, they're directly over their feet. Everything is aligned the way it's supposed to. Now, if someone has scoliosis, what scoliosis is, it's a side curvature of the spine. And there's several different patterns. It could be in the S shape, it could be just one big curve in a C shape. It could be in the upper back in the neck. It could be in the lower back. So there's different patterns for different people. But when you look at this ideal alignment, ideally there should be no curve. We shouldn't be able to measure any degree of curvature from side to side. That would be ideal. Scoliosis, you don't actually get diagnosed with scoliosis until the side curvature is over 10 degrees. So anything under 10 degrees is not actually diagnosed as scoliosis. But there's different degrees to scoliosis. So if you get from 10 degrees up to 25 degrees, that's considered mild scoliosis. From 25 to 40 is moderate, and then from 40 above is severe. So you have mild, moderate, and severe. From 10 to 25, 25 to 40, and 40 and above. There's different things that are done depending on what phases people are in. Typically in the medical community, if someone's in a mild range, let's just watch it and let's wait. Because most people in the mild range, between 10 and 25 degrees, most people actually, it doesn't progress, it doesn't get worse over time. It doesn't, the curves don't continue to get worse over time. And it's close to 33%, roughly a third of people in the mild range will actually progress and get worse over time. And the main reason why that is if you understand the whole concept of loads, loading the spine. So when we think of gravity compressing down on us, so as gravity compresses down on us, it's compressing the weight of our body down on our spine, all the joints in our spine, on our hips. There's a load on our hips, there's a load on our knees, there's a load on our ankle and our feet. So when you look at the spine, if your spine is aligned properly and gravity compresses down on that, there's even weight distribution from side to side. So you're loading your spine, and your spine is going to develop properly. It's going to be healthier for a longer period of time. But when you shift, when the spine is shifted off to the side, and you compress down on that and load the spine like that, there's going to be uneven weight distribution from one side of that curve to the other. There's a couple different studies. One of the studies was from the Archives of Physical Medicine and Rehab in November of 2006. And there was another one, Anatomical Radiographic Studies of the Spine, 1973 by Lee Hadley. Both of those different studies looked at loading the joints. And when you have asymmetrical loading of the joints, the body always responds to the stress that we put on it. So the body responds to the stress that we put on it. What I mean by that is that when you look at your bones, you're putting stresses on your bones every single day. With the loads that you put on it, that's putting stresses on your bones. So your body is responding to that. Now, some of you have heard of this before. There's something called osteoclast and osteoblast inside your bone. What osteoblasts do is they build up new bone. Osteoclasts will tear down old bone. So in response to the stresses that we put on our bones and our structure, your body's going to be tearing down old bone and building up new bone in response to those stresses. Let me give you one example of that. A great example is people with osteoporosis. They've actually done studies with elderly people with osteoporosis where they had them do weight resistance exercises. What's happening when you're lifting weights and you're doing weight resistant exercises, you're putting a stress on the muscles with that weight. You're putting a stress on the muscles, which is putting a stress on the tendon, which is putting a stress directly onto the bone. And that tells your body where to put calcium is where you're putting that stress. So your body will actually grow stronger and new bone in that area. So they've actually been able to reverse osteoporosis just with doing certain types of exercises and weight resistance exercises. Now, if you apply that to this, if your spine is aligned properly and you compress down on that, the weight's being distributed evenly where it's supposed to be distributed. So your body's going to be continue to keep that all of your bones in your spine strong, stable, and healthy because you're loading it in an even manner. But as the spine shifts off to the side, there's uneven weight distribution. Typically what will happen is, this is what's ideal, if it shifts off to the side like this, as gravity compresses down on that, what will happen is there will be more compression on the inside of that curve versus the outside. There's more of a stretch on the outside of the curve. So there's a different load from the inside to the outside of that curve. Your body's going to respond to that, and so it's going to start to put more calcium on the inside of that curvature. Over time, you can actually start to develop arthritis and degeneration. So what happens is your body will put more calcium, more bone down. That's forming bone spurs in your spine. So ideally, what would be ideal is to work to help straighten that out, work to realign that, try to help people go from this to as close to this as possible. Now, it doesn't always get back to that alignment. We've had children below the age of 18 that they got close, almost right back to the perfect alignment. But after age 18, the growth plates in your bones have fused. So the bones, if the bones have grown and have different shapes to them, you're not ever going to be able to get back to this completely. But I'll give you a couple examples. I have a patient in his 70s that came in his lumbar spine, which is the low back. He had a 16-degree curve in his low back, which is mild scoliosis. And after 6 months of care for him, we were able to help him improve that to where he's down to 8 degrees in 6 months. Now he's down to 5 degrees. But he went from 16 down to 8. He's much more stable in his low back. He doesn't have the low back pain that he once had. And he doesn't even have scoliosis anymore. He doesn't have the diagnosed scoliosis because it's below that 10 degrees. I have another patient very similar to this picture here. She came in, she's at 43 degrees. And if you remember, over 40 degrees is considered severe scoliosis. In the medical community, when you're in severe scoliosis, oftentimes, if it's causing a lot of pain, a lot of disability, they actually recommend surgery. And that's where they put rods. They will put rods in your spine and fuse your spine to those rods. And what that does is that keeps it straight up and down. The reason why they're willing to do that type of surgery, which is very invasive, the reason why they're willing to do that is because it's close to 100% of people, when they get in that severe range, that their spine will progress and they'll collapse. Just under the pressure of gravity compressing down on it, their spine will get worse over time, and it can start to affect different organs. Now, back to that patient. I have a patient that she's at 43 degrees scoliosis. She's at 23 years old, had a lot of back pain. She had neck pain. She's also losing function in her left arm. She had a reverse curve in her neck, that's another video. We'll talk about the proper curves and proper alignment. She had a reverse curve, which was pinching down the nerves on her arm. So she had lost function in her left arm, lost all strength in it. So we started working with her, and she went from 43 degrees down to her mid to low 20s. But what I want you to know is that took a lot of time. It took a lot of effort. And it took over a year and a half to get her down into that mild range. But she is doing so much better now. So the scoliosis, it's not perfect. It's not perfect. So depending on where you're at, that depends on, that tells you how much improvement you're going to be able to get. But she went from severe all the way down to mild scoliosis, and she's able to function. She's able to do so much better now without it. So scoliosis, depending on the cause of it, it can be helped. And there's a lot of ways you can help it. We do it with adjustments. We do what's called mirror image adjusting. So if you're like this, we're going to try to adjust you in this opposite mirror image posture. We do a lot of mirror image exercises. We'll do even some stretches and molding and stuff like that outside of the office. And it's totally different depending on the specific pattern that you have of scoliosis, how long it's been there, how much degeneration, arthritis is there. So it's totally different on case-to-case basis, but oftentimes scoliosis can be helped. And you know, there are things like you can do bracing, usually when people are in that moderate range, and again, moderate's from 25 to 40 degrees. People in that moderate range, oftentimes it's recommended in the medical community to wear a brace, some type of bracing. And sometimes the bracing and physical therapy can be very wonderful, but chiropractic can be a wonderful addition on top of that with the spinal molding exercises and stretches and the mirror image exercises. So if you're interested to know more about that, you can always call us, you can always email us, you can write us, whatever you want to do. But if you have any questions, let us know. Just know that just because you have scoliosis doesn't necessarily mean that you have to have it. And there is a possibility that you can see great improvement with it in a natural method without having to have surgery. So hope that helps. If you have any questions, let us know. Have a good day.